Changes in clinical and microbiological periodontal profiles relate to progression of carotid intima-media thickness. Yeehaw! The Oral Infection and Vascular Disease Epidemiology Study. This is so much fun. I love this stuff. That makes me a weirdo, but that's okay. The importance of this, and this is a really important study. What this basically is telling us, number one, if you address a traditional clinical view of gum disease, but also address the new way of looking at what bacteria and oral biofilm are associated with it, you actually slow down, if not reverse, the rate of thickness in the carotid artery. Now, this is a really big deal. It shows us how we can have a great impact as a group. Not just dental professionals getting busier practices, not just healthcare professionals, medical professionals trying to fit into the ACA, but all of us can unite and really have a chance to improve a lot of lives. So first thing I want to do is go over a CIMT. What it is carotid intermedia thickness. Now what the heck does that mean? Well, of course our carotid arteries are in the neck. The advantage to looking at those is because they're easy to get to with an ultrasound. So you can do an ultrasound right here and find out what kind of thickening of the wall of the artery you're getting. It's depicted here, and it just shows how plaque is building up in the intermedia of that carotid artery. Now the reason why this is so important is because in, I believe, 2007, there was an important study done that shows this thickening in the carotid is almost 100% directly connected with thickening in the arteries around the heart. So that's why the CIMT, the carotid intermedia thickness, is so important, because we can easily look here, which tells us what's going on here. This is an example of an ultrasound, and you can see the highlighted marks there. That just shows how that thickens. We have real advanced systems that can be done now. And here is a drawing of the different stages of thickening in the vessels around the heart. So you're on a fast track to a heart attack if you're having thickening in your carotid artery. This is a big study, and this affects all of us. The research shows that 75% of healthcare costs and healthcare problems are based on behavioral problems. It's diet, it's sleep, it's stress. Of all the things you can do to affect your health in a positive way, oral health is the easiest. It's the quickest, it's the biggest payback. Most of my videos in the past have all been directed to dental professionals because I want them to understand how important it is to incorporate this into their practice, to be able to help their patients by addressing what is basically in this study amongst many others. Because now you're not just treating gum disease, you are involved with reducing heart attacks and strokes. Don't hesitate on that, you are. You play a very key role on that, at a much higher level than ever thought. When I talk about old style versus new style, I like to describe that as old style was purely visual, just what you could see. Periodontal probe, pocketing, bleeding gums, tartar, calculus, what you could see. And it worked for us. It helped us save a lot of teeth. The new approach is to look at not only the clinical presentation, which is visual, but in addition to that, to see what is actually there. And we call that microbial burden. Basically, periodontal disease is a chronic gram-negative anaerobic infection. That's what causes it. It's a wound. And when we address it as a wound, we have success. And we have success on two levels. We have success periodontally, but we also have success systemically. One of my biggest missions is to help break down any barrier between medical and dental. And it's not dentists trying to become physicians, it's not physicians trying to become dental professionals. It's breaking down those barriers so we can have a common goal that's coordinated, communicated in addressing inflammatory disease. When these studies come out, they look like they're just proving something we're going to do someday. They're proving what's being done right now. This is a file, cheesy file, but this is just some of the diagnostics that we've done in my office just in a short period of time. I'm constantly being asked by physicians to find a dentist in their area that understands this approach. They're not looking for someone that's just treating patients from a clinical perspective of visual. They're looking for somebody that can address oral biofilm and the microbial burden. We have those solutions. There are advanced systems that can be utilized by dental professionals. There are advanced systems that can be used for advanced home care by the patients. All of these things tie together because we're now transitioning into a new era of health and wellness. Now that sounds like a lot of trouble and a lot of confusion. It's not. And this can be done in your practice. This can be presented in your program. This can be incorporated into any healthcare model. It's a simple cause because we all have our connections with our groups, and by getting all healthcare professionals together and then raising awareness on this important subject, all of us can unite and really have a chance to improve a lot of lives, reduce a lot of healthcare costs, and also reduce a lot of disease.